Is cracking your joints bad for you? We'll talk about this and more coming next on Yala Live. Don't go away. Hi, I'm Moran. Welcome to Yala Live. Today we have a fantastic show. Why? Because we have world-renowned chiropractor and wellness consultant, Brian Paris. Brian, welcome to the show.
Thank you for having me.
Oh, it's a pleasure. We have so many questions for you from our viewers and myself as well. But before we begin, I just want to know, what exactly is your specialty? Like, you're world-renowned for what exactly? Tell me.
Well, I started my career as a chiropractor and saw the need to serve the community with everything under a holistic or wellness perspective. And I've just got a knack for bringing the right people on the team. So I've created a facility that has chiropractic, physical therapy, medical services, acupuncture, massage.
Oh, wow.
All under one roof. So we know that today people don't have time for anything.
One-stop shop.
Exactly. So you get it all under one roof, and we've put a clinical team together that can help solve a problem, get you out of pain quick, and then help you develop strength and deal with health issues that need to be solved.
So you do everything. So it's really a mix of acupuncture and all the different fields in the wellness that you have under one roof.
When I would say that, and it's not like you go to the ice cream store and you get to pick out which one you use, like an a la carte.
Baskin-Robbins.
No, so it's not like that. So we've combined the best philosophies and techniques from all of those arts and put together a system to help you get out of pain quickly, but then also solve the underlying cause.
I see. Now, chiropractors are doctors, right?
Correct.
In your field, do you get to work with neurologists or spine doctors, orthopedic surgeons? Do they see you as peers, or do they see you as, hey, the chiropractors, it's not part of who we are?
Well, it's, the schooling is unique and different. It's, we have to go to college, we have to go to a chiropractic school. So I'm a doctor of chiropractic. I'm not a medical doctor.
Right.
So I have relationships with all of these other physicians in the community. So I'm under the physician umbrella, but my approach is without drugs, without surgery, using the body's natural ability to heal itself. And we've pulled all those elements in from those other arts, with physical therapy and acupuncture to get the body to make corrections to itself with a little bit of coaching or a little bit of nudging, so to speak. But I have relationships with physicians. I have physicians on staff. We refer back and forth all the time. Okay,
so they work well together. Neurologists, orthopedists, they work well with chiropractors.
If you put us in a room together,
you'd be friends?
And you didn't know who we were, you wouldn't really know a difference. But sometimes the degrees get in the way, just with difference of opinions.
Right.
But there's room for everything because people like neurologists or orthopedists, they have their specialists. They're very good at what they do, and they're trained to do what they do. We're everything in between. Right. If you don't need surgery, what else are you going to do? Right. So we fill that large gap, and it gets larger every day.
I see. Okay. When people think of chiropractors, they think of somebody who's going to crack their backs. Explain to us exactly what happens. What's the what are you trying to achieve when you crack somebody's back? What's the physiologically speaking? What happens?
Well, I like to say no to crack.
Okay. We don't use crack in the studios.
So the technological scientific term is called joint cavitation.
Joint cavitation. I learned something new.
What happens is that it's a protective mechanism in all the joints in your body, and when they get to the end range of motion, there's an exchange of gas that allows that joint to expand a little bit more.
Right.
Now, what's cool is that it's connected with neurology, muscles, skin, fascia, everything that surrounds that joint is related to what happens. So when that joint cavitates or releases and the air pressure on the inside of the joint changes, you get a temporary decrease in pain and a temporary increase in range of motion. So it's only a small piece of what we can do in chiropractic as well as other arts. Manipulation, which we can call that, is very different from looking at the spine, seeing what the configuration is, and making long-term soft tissue changes. So there's a definite disparity there. But it's a useful tool in how to help people get out of pain.
So, the cracking that you hear when you have an adjustment, for example, these are not bones knocking each other, right?
Correct. They are not. It's all joints.
Fluid
it's all joints and gas that moves within a closed joint space.
I see.
So it's very safe, very effective, and
certainly feels good. That's for sure.
And it does. Yeah.
I have a bad habit of cracking my joints all the time. I mean, sometimes it's so bad it sounds like the fifth of Beethoven. Yes. I do this also sometimes laying down on the floor at the gym on one of those foam rolls. Crack my back. Is it bad for you? All these years I've heard that it could cause arthritis.
Yeah, and I think that's the answer to the wives' tale, or it is the wives' tale, so to speak, that it does cause arthritis. So, you know what, I've had this question a million times. There's no literature or data that points to it causing arthritis. So that's not true. So it's something that's been passed on generation to generation.
Right.
I firmly believe that if you're stretching in a good fashion, or if you're moving in a good fashion and the joints release or cavitate, it's a positive element to your body moving into a space that it needs to get to. So I look at it as a positive thing. Now, if you're chronically cracking your own joints, it may indicate that there's some kind of issue that's irritating those joints or the muscles or skin or something around it that's surrounding that joint. Okay. So it's different in every case. Meaning, like if you're teaching lunges and you're rotating and your spine cracks, or pops. That's why I don't like to use the word crack, because you think your bone's cracking and something failing. So it's really just getting to that extra range of motion. You're going to get a little more ability. It decreases the pain. You're going to get the range of motion. You'll be able to get more movement. It's a good element of mobility.
Double jointed people, tell me about that. What?
Like ligaments like a cat?
Yes. I see some people at the gym, literally, like, they're able to move their leg completely back, and they tell me they're double jointed, or their fingers go back 90 degrees. Yeah, it reminds me of The Exorcist, when the girl just turns her head
around, yes.
What is that?
That's it's just a unique variation in human tissue. Some people, just like you, look different than I do, and we have different movement capabilities. It's just a quality of someone's tissues that they're able to go a little bit further.
But that doesn't mean that person is more prone to problems later on, no?
Not necessarily. Some cases, yes. I've seen some injuries where people are hyper flexible, or their joints are too mobile, so they can't stabilize as well. So in those cases, we're going to teach someone like that, if we get them young enough, to learn how to stabilize, use the other components of their body, the muscle, posture, things like that.
Okay. A person comes to you suffering from back pain, knee pain, shoulder pain, whatever pain. What exactly is the chiropractor able to do, and when does it go beyond its scope of practice?
Great question. Well, the first thing is, we want to do a very thorough exam and a history. So
run this by me. Like, a person comes to you and says, "God, I don't know what's wrong with my back." What exactly is the steps that you do with that person?
So what's cool is that, having an integrated clinic, we've created a system to be able to onboard patients, right? So patient will come in. First, we're going to do a consult. Tell them or ask questions about, what they know about their previous condition, what experience they've had, and then we're going to really get a detailed health history. Now, what's a very interesting piece, and this may play a role, is that we want to make sure that everyone understands how insurance works, how all that kind of stuff, because that becomes a barrier to getting well a lot of times, because people are like, I don't understand my insurance, I'm not coming back anymore. So we take the time so that someone understands that, then we can move forward clinically. And you have a very clear picture, and you have a lot of clarity to how your body can get well. Get that stuff out of the way. So we do the history. Our first step in my office, we're going to do a thorough physical exam. So we're going to look at your capabilities of moving. If you're low back, we're going to do palpation, meaning we're going to feel all the muscles. We're going to look at ranges of motion of the joints above and below and surrounding areas. Then we're also going to investigate, because a lot of times, wherever the pain is, that's not where the cause of it is. Many times, left shoulder pain is caused from right hip problems.
It's a referred pain.
Exactly. Or it's a pattern. Right, so your body works with patterns. So it could be, if you have an injury in your neck, it could be referring pain down the arm. However, when you have a chronic shoulder injury, it could be because your left shoulder's not moving or your left hip doesn't move right. So we have to look at all those elements. If x-rays are required, we take those on site. Also, if we feel that you need a more medical-based exam, we can refer you to the room next door. We'll be able to create that as well. So in the first visits, we're going to be doing some treatment to work on calming down some of the pain reflexes. So we like to take the pain away first, deal with that element, then we're able to look at the whole picture. Is posture causing the problem? Was it a sport injury? Is it a chronic repetitive habit? Sitting at the computer in that type of fashion causes a lot of injuries all over the place. So then from there, the next step is we go over the results, go over the plan of action. We start with the chiropractic care, integrating that with physical therapy. So it's all about lining posture up, getting the body to move in the right fashion, creating strength where you need strength, mobility where you need mobility, stability where you need stability.
And when does it go beyond? When do you see a case when you say, there's nothing I could do?
We like to give it roughly, I'd say anywhere between 6 to 12 visits. Because in holistic care, it's not about the diagnosis per se. We want to know, you've got a disc herniation, we've seen all those tests. But and I think you've experienced this yourself. When you get treated, it's really about how you respond to the treatment.
Right.
Because your body's going to start taking over at a certain point when we move all the garbage out of the way.
Right, of course.
Whether it's a thought pattern, whether it's a movement pattern, whether it's tissue that's damaged.
Right.
So we like to give it a period of time, roughly, 2 to 3 weeks. If we can't get a result within that 6 to 12 visits, we're going to either send out for diagnostic tests, send out for the appropriate referral, and anything along those lines.
I see. Okay. Well, I think we're ready for some questions and answers from our viewers all around the world, by the way. Huh? We have Guy from Maryland. Guy, this is what he's asking. I suffer from constant lower back problems. I feel stiff in the morning. It loosens up as the day progresses, but it's always there. What can I do? I guess when humans decided to walk, back started mess around, So what do you think? I mean, I guess it's a common question,
What do I do?
Well, how do you answer this question?
I'm going to answer the question with a question. What are you doing, Guy? Do I look out in here and say, Guy, tell me what you're doing on a daily basis?
Man, I wish we had this kind of system or this where the viewers could just ask questions live and we could answer right away. This is a guy that suffers from lower back problems.
I think it's important for a guy to look at his daily life. What's he doing? If it wasn't an injury, like a sports injury, car accident, something like that, what are you doing on a chronic repetitive basis that you get up and your back hurts? Paying attention to that, it hurts more in the morning and it feels better. When you wake up, it's like putting a pair of pants in the dryer. Everything's all dried out, dehydrated. Sure. You got to look at your levels of hydration, look what you're doing on a daily basis.
Right.
Back pain it's not always just simple muscle problems. You have to look at what's happening on a daily basis so that you can address every element. You're eating foods that are bad, and if you're eating foods that your gut is reacting to on a constant basis, you can't engage your core, then your low back is exposed for injury, and that could have injured it as well.
And you brought a good point, you say when you wake up in the morning, your body's a little dry and everything. I feel dry sometimes in the morning. Is that a normal thing to feel like that?
You're absorbing all the water when you sleep. That's
so,
you're
but
healing.
In terms of dry, my back, also bothers me. Are you supposed, a person that goes through chiropractic care and all that kind of stuff, should he wake up in the morning happy and Mickey Mouse jumping up and down with no pain anywhere, or a little pain in the morning is normal?
Well, let's say in a box without kids and work and all that stuff, yeah, I'd like to see everybody jumping up in the air, but little pains here and there, it's really, pain is relevant to each person.
Right.
And I think when it becomes a chronic thing, like you're waking up every morning and it's interfering with your life, then it's in the way. But if you're an athlete and you're working out, you're going to get injured. Things happen. And so I like the fact it kind of tells you you're alive. It says, all right, I did something and maybe I shouldn't have pushed it that far. It teaches me my limits and my boundaries. So
I'm alive.
Is it normal to have limping pain, searing pain coming down the leg, numbness and tingling in your hands and fingers every morning? No, that tells you that there's something wrong, right? But those little things, little aches and pains there, we get older and we're living a lot longer as humans. So we were not designed to sit in cars, use iPhones, and sit at computers. So if
we're supposed to hunt, right?
Yeah, hunt.
Go after
it's
mammoths.
Like squat, push, pull, twist, and lunge.
Right.
And lift heavy things, and sprint. All those things are normal for us to do in our evolutionary makeup, but we've taken it out slowly.
Right. Technology. Here's another question from Lynn from DC. I had a meniscus injury and I want to avoid surgery. Can chiropractors help me, or is surgery the only way?
She's meniscal tears. Surgery is not always the answer, and I don't want to comment directly on it because I'm not an orthopedic. I have people that are on staff that deal directly with knees, but we deal with a lot of knee issues through physical therapy, strengthening the joint, because some people don't want to do surgery. And sometimes if you get meniscus surgery, it works or it doesn't work.
Right.
And you have to look at if there's arthritis in the joint. That may be a cause of the problem. You can look at the joints above and below. That may be causing movement problems. So it's a loaded question, so to speak. It's not easy, so you have to really look at all elements. I like to avoid surgery and keep it as the last possible thing to do.
Right.
So try every possible element out there. For knees specifically, we use what's called viscosupplementation. So it's a supplement that we can inject within the joint to allow an arthritic joint to breathe and get some space, and then you can really do some awesome physical therapy and movement therapy on it.
I like that, but we'll be right back. We'll be right back in 2 minutes. Don't go away. Hi, I'm Laurent. Are you tired of the traditional push-ups? I know I am. So I'm going to show you a different way to do push-ups that will work even harder. So go into a push-up position, You're gonna go down. As you go down, you split and you go back in. Split and back in. This is a great exercise, but because it also works your inner outer thighs, and as well as the upper body as well. And back, just like that. Repeat this 15 times. I promise you, your whole body is gonna be dead. I'm Laurent, et à bientôt. I've had a chance to get a few treatments at the Advanced Spine and Wellness Center with Brian Paris. This is how it looks like. Hey friends, I'm here at the Advanced Spine and Wellness Center in Rockville, Maryland, where my friends Dr. Brian Paris and Andrew Block are going to take a look at my back. I've been suffering from lower back pain for a lot of years now. I'm in the fitness industry, I'm in the gym a lot, on my feet, so it took a toll over the years. So I'm here to find out if chiropractic care will work for me. Let's find out. What are you guys going to do to me?
Okay, so we're going to start by heading over to the tables. We're going to see what kind of movements you can do and can't do. Okay. So our job initially, Andrew's technique is called reflexive pattern therapy. So it's a combination of manual therapy and some acupuncture points that are keeping your body in a pain state and reflexively holding it tight.
Okay.
So the first step is to get your body loose, decrease some of those reflexes so that you can actually see what other potential problems are causing this low back pain long term.
Okay.
We're then going to go over to the chiropractic portion, look at your posture, see what distortions may be causing you to be stuck, and we're going to unstuck those.
That sounds great, right? You're going to take good care of me, right?
Absolutely.
All right, let's do it, guys. All right, Andrew, so basically, lower back is messed up, all right? And apparently you got a special technique that could help me out. Talk to me about it.
So first, tell me, where is the problem?
It's this lower back right here. There's a band over here that is unbelievable. A demon is living in my lower back, and it doesn't want to leave me. So when I do this, for example, it bothers me.
Okay, perfect. Come first, lie down on your back, face up, okay?
Face up?
Yes.
Oh, that's a comfortable bed over here. Could you mind turning down the lights a little bit?
That's what we shut them off on top. Okay, so first what I'm gonna do is I'm gonna palpate a couple points, okay? And we're gonna see if they're reactionary at all, if they're tender at all. So
articulation, that's for sure.
Yeah, ticklish is actually the same as pain for me. So you can see the difference between the left and the right side.
Okay.
You tell me, which side is more tender or ticklish?
This one. Yeah.
So I use reflexes instead of like normal like stretching or exercises.
Right.
I use reflexes because the reflexes use the autonomic nervous system.
Let's
I
use it.
figured out a system to actually get rid of all your pain in usually less than a minute.
Man, that's great. In a minute I'll feel fantastic. I like that.
Keep your eyes closed.
Oh, shit, that's never a good sign.
That's the only thing you have to do.
I have to look like a mummy still?
Just don't cross your fingers, cross your eyes, close your eyes. You see the difference?
There's something over there. Get rid of it.
You don't feel it.
Ay, what the hell is this? Wow. Just cut it, it'll be easier.
Much more.
Is that normal? Like, should humans feel like that? Oh yeah, basically you tell me I'm messed up, right? Oh, what is that? Doctor tells you, oh.
Bend your knees.
I've never had a man touch me this way, I have to admit, huh? Taking all this abuse, now I know how my clients feel.
Okay, now let's repalpate some of those things.
Okay.
You keep your eyes open now.
Open.
Keep your eyes open. How's this now?
Good? Yeah?
How's this now?
Ah, good. Yeah.
Much better, yeah?
Yeah?
Yeah. Remember, this was very tender. You almost got mad at me. Much as it, how's this now?
Yeah, it's nice.
Remember, your neck was very, very stiff.
Messed up, yeah.
Yeah, relax your head, yeah? How's this now?
No problem, you
No
could.
pain now.
I feel like the girl in that movie, The Exorcist now.
It's almost like a massage type feeling, just takes a lot less time.
Hey, whoa, that's just like... Oh, what is that?
This is almost like acupressure in a way. It's a reflexive, but I use it along different patterns and energy system that's not familiar to the somatic.
Okay.
It's tender. Yeah.
They use that in construction also, right? To make holes in the street?
I could use it for that. I think that's where someone made it up. So in the chiropractic world, this is used, but it's used differently.
What is it? What is that called? A jackhammer? What is it?
Yeah, basically.
Oh, wow. I'm going to try that on my... Could I rent this? I'm going to try this on my wife tonight.
She already paid me, so she's first. Come stand up now.
I stand up now?
Yeah, see how the back feels now. Looser.
Yeah.
The key is the looseness.
Oh, yeah. It's looser. Yeah. Much looser.
Yes.
Uh-huh.
You know, obviously you're not going to cure back pain one visit.
Right.
But it's more to work on getting you to feel better. My job is to get you to feel better. The whole job is to get you to well.
I like that job.
So the second part more is to look more at your posture, maybe some things from the somatic side, the stuff that you do,
Right.
that may be causing some of your issues.
Oh, so you tell me there's more.
There's more,
Oh,
but that's not my job.
Okay.
That'd be Dr. Paris.
Oh, that's Brian Paris.
Yes.
All right.
Exactly. So
Well,
let's get you over there.
Thank
We'll
you
get
so much.
there.
That was
Yeah.
fantastic. I love that.
You're welcome. Thank
Man.
you. Thank you.
All right, we're back with Dr. Brian Paris and more questions from our viewers. Here we go, Brian. Tony from New Jersey. Forget about it, huh?
Tony.
You're from Jersey, right?
I'm from Jersey, yeah.
Tony from New Jersey. Here's his question. I work in my car and my sciatic nerve is killing me. I hope that's not a metaphor for anything, you know? I have to keep stopping to stretch every few hours. Any suggestions?
Well, I'm not going to tell you to get out of the car because you got to work and make a living, Tony. So I get. Tony has to do that. But the sitting,
help Tony?
the sitting is a major pressure on the spine. So they show that all the scientific studies show that when you sit, you put a lot more pressure on the spine, especially the discs if they're weakened and already susceptible to injury.
Right.
So that's an issue that's got to get addressed. So Tony can check in Yala Live and online, and I can send him a referral in Jersey because I got tons of connections there. But
Okay.
But it's something that needs to be treated. It's you can't just ignore it. Sciatic nerve pain is something
yeah.
that it's not. Sciatic nerve is typically not an acute injury, meaning like it doesn't happen. It's a chronic, repetitive thing from sitting in the car. So changing your car position, having your spine checked by a chiropractor, physical therapist, someone in that realm of care should get them checked and don't let it go any longer.
All right, Tony. He's got some connections in Jersey. He could help you out.
Connections.
He's got some connections, Tony from New Jersey. We got Jessica from DC. Hey, Laurent, I love your show. Thanks, Jessica. I love you too. Maybe you can help me out. I'll certainly try my best. I love to run, but over the years, I have developed plantar fasciitis. And now my knees are causing me trouble. I ice them after a run, but the pain is constant. Please help. What do you think?
Well, when you're looking at plantar fasciitis or knee pain, you have to look at the entire kinetic chain.
Right.
So
Always.
you know the song, the hip bone's connected to the I don't know the whole song anymore, but all of our tissues and movement patterns are connected by fascia and the way that our brain will move that. So
if you could explain a few words, like for our viewers that don't know what the plantar fasciitis is.
So when you eat a piece of chicken, you take the skin off, and then there's that thin white layer on top of the meat.
Right.
That's fascia.
Right.
That,
Connective tissue.
Connective tissue. So
Right.
it lines all throughout our body and has different patterns of attachment.
Right,
You
right.
know, when anatomists first learned about anatomy way back then, they cut the bones and they looked right in them. But
Mm-hmm.
now anatomists have taken a different look and they're peeling layers away and they're seeing the interconnectedness of body parts. So when you have restrictions in movement in your hips,
Right.
it's going to relate down to the fascia on the bottom of your foot.
Right.
When you have a restriction of movement in your neck, it's not like it's a cousin of your low back or your hips.
Right.
They're all connected and
all connected.
interconnected through tissue.
Absolutely.
So once you start getting a biomechanical issue, which oftentimes starts with somewhere in the hip, foot, ankle, knee,
Right.
or low back,
Pronation,
and
supination.
all of those different things can
Right.
start, the initial fasciitis, plantar fasciitis under the foot, where the tissue gets inflamed, it's irritated. You start changing your movement pattern,
horrible.
and then the movement pattern changes on the knees,
Right.
and then the knees start wearing down quicker. So, taking a look at the entire kinetic chain versus an isolated view of where the pain is the best advice I can give for everybody. Look up and down.
Right.
I usually look 6 inches above, 6 inches below, to the left or the right, wherever the pain is,
Right,
because
right,
it's
right.
typically not where the cause is.
All right. Paul from Baltimore. My lower back has always given me trouble. Is it okay to put it in traction? That reminds me of this, I don't know if you've ever seen this infomercial of this, I don't know if Virginia could look for the clip that we're going to put it on, of this device. It's like one of those swivel things where you lay down on the floor, you put your legs, and it swivels, and then it just massages kind of your back.
Yeah.
And then there's a chiropractor, obviously, that promotes it
Created
and
it,
all.
yeah.
Do you believe in that? Does that work?
JFK had back problems, and he used to sit in a rocking chair. Right?
Right.
So movement is medicine. right? So
Okay.
especially when it comes to back pain, because there's typically musculoskeletal or neuromusculoskeletal involvement. So movement is going to help the body heal no matter what. So
Right.
any tool that's not going to hurt you is going to help you. So if that's a good tool and it feels good for your back, I'd promote it. I'd say go do it. But still, getting checked to figure out really what's going on is a much better approach.
Right. It's a funny commercial. I mean, the person lays down on the floor. It looks like she's big smile on her face in a sexual position. It's a funny infomercial.
Well, the question here was traction.
But
right?
traction, yes.
Yeah. So traction is a good element because it can, it literally will distract the spine and it depends on how heavy the machine is. But typically it gets a little dangerous when you start pulling too far. Right? So you want to get it to a component. We like to use a traction device that is intermittent, right? So it gives you a stretch and relax, stretch and relax.
Oh, I see.
So
so you don't
over a
stay
period,
in a stretch position.
Yeah, and sometimes that static stretching, you can get a response where your muscles will spasm. So, if fitness is just a hobby and movement is just a hobby, definitely find someone who knows what they're doing, so that you can avoid further injury.
Okay. Erwin from Kansas City. I'm a quarterback in high school, hoping to make it in the NFL. That's not bad.
Awesome.
I don't have any back or neck issues. Can I use chiropractic adjustments as a preventive measure in order to avoid injuries in the future? Do pro athletes use chiropractors?
I would say a majority of pro athletes use chiropractors. They have them on their teams. From every sport that you can think of, we work on those athletes, and those professional teams have them on board. That's awesome how proactive that guy is, because you can use chiropractic care, especially posture-based work. I do a specific technique called chiropractic biophysics that really looks at the postural alignment, and which helps with all of your movement and muscular capability. So it's going to make you a better quarterback.
So even if you don't have any pain, having chiropractic adjustments or care as a prevention method is perfect.
Phenomenal. Yeah.
Beautiful.
So with young athletes, and if I can stress this to the young athletes out there, you have to take as much pride and intensity towards your recovery, active recovery, as you do training.
Right.
Because the biggest difference between someone who's going to make it to the NFL and not is typically injuries, because you get a lot of people at the same level, but some person's plagued by a chronic injury. So taking a discipline to active recovery, doing chiropractic, physical therapy, mobility work, foam rolling, all that kind of stuff should be part of your typical routine.
Perfect. Well, there you go. Erwin from Kansas City. Manuel from Arlington, Virginia. Hola, Manuel. I suffer from constant headaches. I also snore at night. Poor Manuel. So my wife makes me sleep on the sofa. Thanks for sharing this with us, Manuel. What can I do? Seems like Manuel has a few problems, including domestic issues here.
Yes.
What do you think of headaches and snoring? Is it interrelated?
So I indirectly do marriage counseling, because if we can help you stop snoring and we can help you sleep,
then get back with his wife.
Exactly.
Everybody's happy, right?
Well, there's a couple elements here. One of the big things is that headaches and snoring themselves. Well, snoring is the #1 sign of sleep apnea.
Right.
So definitely get checked for sleep apnea.
I see.
We work with a company called Sleep Co. that actually can test you for sleep apnea at home. Put a nice little device on here in the nose. You can get tested at home, and if it's a severe sleep apnea, you'll need to do what's called the CPAP, which puts the air down, the Darth Vader mask, which is not always good for marriage either. But I mean, you got to do it if you have severe sleep apnea.
I am your father.
But, yes. But a better option is an oral appliance if you don't need the CPAP or you can't wear it. So we work with a dentist that actually fits this retainer in your mouth, so that you can open the jaw and breathe and not snore.
See. So you have to sleep with it every night.
Yes, correct. But it's going to save your life. Now the headaches also are a typical symptom of sleep apnea. So I would rule out sleep apnea first and really take a look at all those other elements that could be causing those symptoms, because it's not always musculoskeletal when it comes to those symptoms.
So Manuel should check first for sleep apnea and then go from there.
Correct.
All right, I think we'll get time for one more question. Vin from Los Angeles, California. As in Vin Diesel, wow. I love the Fast and the Furious movies, by the way. Vin asks, when working out, I sometimes feel weakness in the right side of my body, like it's not as strong as the left side. Can chiropractic adjustments help?
Yeah, I mean, if there is an asymmetry in the body, the aim of chiropractic is to create symmetry. So if you're not able to fire off part of that body based on postural asymmetries, then certainly, yeah.
So that could help.
Of course.
So it has nothing to do with maybe pinched
That is
nerves?
that
or?
is a possibility as well. But when someone brings up the term of their entire body and you're a young person, it's not likely that it's those things. You know, you'd always want to rule those out, which is why we do an exam and take X-rays and figure out what's going on. But typically, you know, when you're looking at it, someone in a younger age that's working, you know, or working out and not feeling that power, you look at postural asymmetry first, rule out all those other.
Okay, and I think we have 30 seconds. Like, you know, would that help as well for obesity? Chiropractic adjustments?
Not per se. I think if it motivated you to get healthier and change the way your brain's thinking about food and your relationship to food, then yes. But I wouldn't say there is a direct relationship there.
All right. Well, that's all the time we have, guys. Thank you so much, Brian, for being with us in the studios. I really appreciate it.
Thank you for having me.
And thank you. It's my pleasure. And thank you so much for watching. And remember, life is beautiful. So stay healthy, my friends. I'm Laurent, and as we say in French, à bientôt.